Scientists at Cambridge University say Ebola could one day be treated with a new type of vaccine designed by artificial intelligence. In a world first, they say they've used AI to develop a single jab that could protect people from thousands of viruses. Well, joining me now is Paul Hunter, a professor in medicine at the University of East Anglia. Paul, this sounds like a major breakthrough. How significant is this?
Well, I think the first thing is that we've got to be a little bit cautious. What they've done is developed what's called a pan-SARS-CoV vaccine. So that is basically just against one subtype of coronaviruses, the SARS-1 and the SARS-2. It is not, this vaccine that they developed isn't something that will also work against Ebola and dengue and other viruses. So it's a much more restricted vaccine than the headlines would suggest.
But we know that it has been used it's been developed by AI, hasn't it? That's been used to develop this vaccine, absolutely, which does seem to be the stuff of science fiction, doesn't it? Explain a little bit more about what this AI has actually done to create this vaccine.
Well, it's not clear from the published evidence exactly how the AI worked. But I will say we are increasingly using AI in medicine and in medical research, in ways that perhaps speed up what might take considerably longer if it was done by more traditional methods. So I think what they will have done is they will have looked at a range of different coronaviruses and looked for places that were similar between different strains, different species of the coronavirus vaccine virus, and then targeted those for the effectiveness for the vaccine, and they do seem to have managed that, at least for the coronaviruses, but we're still a long way from actually producing a vaccine that will have value in society. It's got to be tested. The human studies that they've done so far, they pointed out that the strength of the antibodies that they generated wasn't that great compared with what we're seeing more widely with coronaviruses. So a very important development, but one that I think still needs a lot more work before we have something that can actually make a difference in the real world. But there is still substantial potential there.